Hey y'all, a bit of a late start this Wednesday, but we are here. I hope you are doing well. I'm gonna jump right into it. Today we are continuing this 3-week series that began last week. And this series is all about the different types of medical and health writing that exist. I have a lot of conversations with fellow healthcare providers who are interested in pursuing some type of medical or health writing, perhaps as a side hustle, or perhaps you are looking to completely transition your career. A lot of people I talk to happen to be looking for ways to get out of direct patient care and but still want to utilize their degrees and their experiences, professional experiences in some way. And so medical and health writing is a great route, a great avenue to do that. But the thing is, there are so many different types of medical and health writing. And in order to really get yourself in a position where you are going down the trajectory that you can be successful in medical or health writing, you have to kind of have an idea of where you want to go so that you can build up your credentials, your experiences that align with that particular track, that particular lane of medical or health writing. So that is why over the course of last week and the next 2 weeks, we've been talking about what those individual types are. So if you missed last week's, we talked about regulatory writing, medical information, and medical communications. That video is still available on my LinkedIn account via the replay. You just scroll down a little bit and you'll be able to replay it. You can also go to the YouTube channel. It's called Health Writing for Health Professionals. And all of the videos that I do every Wednesday are on that YouTube channel. So whichever way you want to do it, you can watch the replay of that. Today, we are going to be talking about two other types of medical writing, and those are medical education, similar to or equivalent to continuing education or continuing medical education. And the second one we're going to be talking about today is medical grant writing. And these two are they're not similar in terms of like what the roles and responsibilities are, but they kind of exist in similar spaces. But we'll dive into that a little bit more later. If you have not joined one of these videos before, really great to have you here. My name is Megan Freeland. I'm a public health pharmacist turned health content strategist and health communication specialist. I provide culturally relevant content strategy for digital health companies. And I also run the Health Professionals to Health Writers coaching program. So that's where I help health professionals use their clinical expertise to build additional income streams through health content writing. Health content writing is a very specific type of health writing that we're going to be talking about next week. So make sure you follow me either on LinkedIn or Instagram, whichever one you might be listening from, if you haven't already, so that you are aware when these new videos happen, which, by the way, is every Wednesday at 7:30 p.m. I know I'm talking a little bit fast, so I'm going to slow it down so that you can make sure you get all the good stuff we're going to be talking about in regards to medical education and medical grant writing today. Also, if you happen to be catching live or on the replay, feel free to leave a comment, ask a question. I'll be able to respond to it, even if it's, days from now. That's fine. So I am going to start with medical education. For both of these, we're going to talk about what it is. We're going to talk about where you can find these types of opportunities, and we're going to talk about how you can get started, a few of the initial steps that you can take to get started in this particular type of medical or health writing. So medical education, most of us who are watching this should be very familiar with medical education, because if you are a healthcare provider, chances are you have some type of continuing education requirements that you are required to complete in order to either gain your licensure in whatever particular health profession you're in, or maintain that licensure. Or that credential, that certification. So for pharmacists, that might be CPE. For physicians, that might be CME. For nurses, that might be CNE. There's various types of continuing education, but they're all kind of, we can all lump them together for the purposes of this conversation right here. So being that we have to participate in these various CE programs in order to get or maintain our credentials, it probably makes sense, right, that there is a lot of CE available out there. There are a lot of different ways and opportunities for you to get the CE that you need in order to, check the boxes. And also, of course, to continue your own professional development and learning. But being that there is so much available, that also means that there are a lot of people who have to create these materials at a large scale, right? And so these people work in medical education. They create educational resources, oftentimes in the form of continuing education and possibly also for board review. So they might be creating test prep materials for board exams, and also continuing education materials for people who already have the license or the certification or what have you. One of the cool things, I think, from a communications perspective about CE is that it's delivered in so many different formats, right? So you could go to Google right now and you can search for CE, and you would find a couple of websites that have free or paid CE in the form of, an article. So you read a lengthy article, you take the test, you get your CE. But as you know, there are also a lot of other formats of CE that are available. So there are videos that you can watch and take a test. There are conferences that you can go to and you can rack up like a lot of CE at these conferences because you're going to in-person presentations where people are delivering CE presentations. You might go to a dinner or a reception where there's CE being delivered. So there are a lot of different formats, which means people who work in medical education to create these CE materials are not just, they're not always just writing an article, right? Or writing some type of summary of the information. They might be preparing that information for different formats and having to figure out what is the most effective way to convey this information. What information do I need to convey? What information needs to be tested? And so as a part of this process, they might also be developing what are called needs assessments. And then needs assessments are tools that help you figure out what are the gaps in knowledge, and then how do you fill those gaps with the medical education, with those materials. And so once you have a needs assessment, you can kind of create learning objectives that help fill those needs and fill those gaps. So that's kind of an overview of how medical education works and what the writers who work in medical education are doing. As far as where opportunities are, there are actually several dedicated medical education companies where you would find roles like these. So some examples that you might think of: Haymarket is a large medical education company. Medscape is a huge one. PowerPack. Think of different companies that you might go to in order to get CE. They oftentimes have these types of opportunities there. And of course, if you go to Indeed or different job boards and you type in medical education, you'll also start to see examples of places where these opportunities are. As far as getting started, just like last week's video, my number one recommendation is going to be to connect with other people who are already in this field. So if you know of someone who works in medical education, they might be a great resource to talk to and learn more. But even if you don't know these people directly, LinkedIn is an amazing resource because you can use that little search bar up top, type in medical education, and you can find people who have that type of role listed in their profiles. Connect with them, reach out to them, engage with them, build relationships with them, learn from the content that they share. And in that way, you start to kind of get a better sense of what these types of roles involve, and can maybe even ask them to have, a short informational interview to discuss their role or their company and things like that. Also, of course, again, you can go to those job boards and look at the responsibilities and the duties that are a part of those listings. I would say another practical option for you as a health professional, right? You are probably working in a setting where you have colleagues who also need CE. And so there are definitely, I know for me, when I was in those clinical settings, there were definitely opportunities to create CE presentations and then deliver those to colleagues in the workplace. And that's a great way for you to get practice with creating CE materials. Students, if you are a student, especially if you are in doing your clinical rotations, this is also an opportunity for you. I think the first time that I delivered CE was in my rotation year, but you can definitely reach out to your preceptor and say, hey, I would love to deliver a CE presentation to the pharmacist on staff, or, have a lunch and learn and things like that. And that's the way that you can actually get tangible experience with creating those CE materials. Also, I would encourage you to diversify the types of CE presentations or CE materials that you are using to get your own continuing education credits, because that way you can get a more broad perspective on what types of materials exist. And not only can you listen for the education, right, for the health information, but you can also listen for an understanding of, why did this person write the learning objectives that way? Why does a presentation flow like this? Why did they include this information and not that information? How was it delivered? How was it created? Those more analytical aspects of the materials, which will help get you in the mindset, not just of someone who is consuming them, but someone who is creating them. So hopefully those are some helpful tips as far as medical education. The second, again, if you have any questions, feel free to drop them in the chat. The second type of writing we're going to talk about today is grant writing, specifically medical grant writing. And this ties in pretty closely with medical education, because a lot of times medical education programming is funded through grants. And so that's getting more into the weeds than we need to today, but I just wanted to highlight that so that you will understand how those two are connected. But as a medical grant writer, these are really interesting roles because it really involves a lot more than just medical expertise. The goal of when you're writing a grant proposal, the goal of that is to put together a package that will convince a group of decision makers to fund your project, right? So it's not that you're just taking your medical knowledge and you're throwing it in there and then you're going on about your day. You are having to think like a persuasive writer, right? Because you're essentially trying to persuade someone to do something. And that necessitates a very strategic approach to selecting the grant. What funding sources are you going for? How are you going to put together this package? How are you going to make your initiative sound as attractive as possible to this third party or the group of grant reviewers? What makes your initiative so great, basically, and how do you present that in a way that is convincing? So you have to have strong persuasive writing skills. You also have to be able to convince that reviewing body that your work is deserving and impactful, and also that it aligns with whatever the mission of that funding party is. You have to be able to write with clarity in order to get that point across. And so I think when I talked about grant writing on my LinkedIn account several months ago, there were a couple of people who chimed in with really helpful insight. And so I'm going to read you a couple of those comments because I think they'll be helpful. Kendra Valentine, thanks for this added tip, Kendra. Kendra Valentine said, also important to grant writing is the ability to discern what the key factors are for winning a specific grant, and then being able to clearly align those key factors with the value that your institution can provide. So that's where that strategic alignment that we just talked about comes into play. And you have to be direct. You have to make that direct connection. And then Kendra gave an example. She said, if you cite community building as a key value for your project, but that grant calls for innovation first and foremost, that's not in alignment. Community building and innovation are not necessarily in alignment. And so it doesn't matter how important community is in the bigger picture. Like, we know that community building is important. That doesn't matter because that isn't necessarily the goal of the grant. Community building doesn't align with the goal of the grant. So you have to be able to take a strategic approach and make sure that your values and the values of the grant are in alignment, and then be able to make that connection very clear. There was another person, a pharmacist, Dr. Maria Glukowski, who also added a point about alignment, but also mentioned that it's important for the project to be able to close a gap and solve a problem. And so again, you have to be able to communicate the fact that this project is going to close a gap or solve a problem. If the grant is looking for a specific provider that's involved in this ideal area, where the supporter wants their platform, their message to be reached, then you have to be able to draw those connections. And so I really appreciate them chiming in on that post. And I would encourage anyone else who's in grant writing or medical education, if you have insight that we didn't touch on today about, what you think other healthcare providers interested in this space might need to know, feel free to drop that in the comments, because I think everybody would benefit from that information. So as far as where are these opportunities in medical grant writing, pretty much any type of institution or organization who seeks funding is going to have a need for a person who can write grants. So you can think of, again, these medical education companies, because a lot of that programming is funded through grants. You can think of medical communications companies, which we talked about in part 1 of this video. Also academic institutions, especially those that are research-based, and professional associations and foundations. All of these types of institutions might have grant writers on staff or work closely with grant writers, because they're often looking for different funding opportunities. So as far as how to get started, if you are interested in grant writing, I think that joining AMWA, the American Medical Writers Association, is always a good idea if you are interested in any type of medical writing where your audience is going to be another like medical professional or someone kind of in the medical space. I think, again, connecting with grant writers on LinkedIn and leveraging those opportunities to connect with people and learn more about what they do. There's also a very specific resource called Effective Writing for Healthcare. And this particular track is called Writing Grant Proposals. This is a certificate program that's offered through Harvard Medical School. If you just Google Harvard Effective Writing for Healthcare, the program should come up. There are 3 tracks, and 1 track is specifically dedicated to writing grant proposals. So if you are someone who is interested in grant writing, I would look that up. And I'll be honest, the program is, it's a Harvard Med School certificate program. So there's a couple of digits there, but even if that's not something that is in your budget right now, I think still reading through the brochure, looking at the information, what's taught, can give you an idea of what types of things you would need to learn if you were interested in pursuing medical grant writing as a career. So even if that's not something that you're willing to invest in right now, I think it's still worth looking it up, because it'll help you learn more about the space. So again, that's Effective Writing for Healthcare, a certificate program through Harvard Medical School. And then the last thing, if you happen to work at an organization where there are grant writers already there, connect with them, have an informational interview, find out whether there are any opportunities for you to support them on a project, or like a piece of a project, to kind of get your feet wet and get some deeper intel about what their day-to-day looks like and whether that might be a good look for you. So those are the 2 topics for today. Again, if you are someone who is already in medical education or grant writing and you have a suggestion that you think would be helpful to other health professionals who are interested in the space, I would love for you to leave a comment below. That would be super helpful. And if you are someone who is interested in the space, make sure that you start taking these steps that we talked about today. At the very least, Once I finish talking, go to that LinkedIn search bar and type in either medical education or medical grant writing and start connecting and reaching out to folks, connecting with and reaching out to folks who have that background. I think that is it for today. Again, if you have any questions, feel free to drop them in the comments. Part 1 of this series, again, is available on my LinkedIn account and on YouTube. And I'll also drop a link in the comments in case, just for convenience sake. And make sure to join me next week. Next week, we're going to be talking about 4 different types of health writing. I personally distinguish medical writing and health writing. We'll talk about why more. If you haven't heard my little rant about that yet, but make sure to tune in next Wednesday at 7:30 for that conversation. And I'll see y'all next time.